So my patient here is a 31-year-old female. I'm going to go ahead and do the general survey. Just by looking at her, she is alert and awake. She is making good eye contact throughout the assessment. She has good hygiene. She's appropriately dressed. Can you tell me where we are today?
The hospital.
Good. Can you tell me what brings you in today?
A general checkup.
Okay. By asking those questions, I know she's alert and oriented. Looking at her skin, it's appropriate for her ethnicity. And I'm going to go ahead and do the head to toe assessment now. So I'm going to go ahead and just palpate your scalp. Tell me if anything is tender to the touch. Nothing?
No.
Okay. So her scalp is non-tender to the touch. I don't feel any bumps or lesions. Her hair is evenly distributed throughout her head. Her head is normal cephalic. I'm going to have you frown, smile, okay? Can you open your eyes against resistance? Good. Okay, and then I'm gonna, tell me if you feel this on both sides.
Yes.
Okay. And I'm going to have you clench your jaw. Okay. So this tells me that cranial nerves 5 and 7 are intact. So I'm going to do the fundoscope exam. I'm going to test if her red reflex is present. I'm going to look at her optic disc shape. I'm going to see if there's any retinal hemorrhages, if I see any previous injury like cotton wool spots or anything like that. Have you had any previous eye injuries before?
No.
Okay. Go ahead and look forward. Okay. So nothing is noted. I don't see any spots in her eyes. I don't see any redness, bulging, arteries or anything like that. So I'm going to assess her ears now. Just by looking at her, I know that her ears are symmetrical and they are even throughout. I don't see any drainage or redness when I'm looking at them. I'm going to go ahead and palpate and tell me if there's any tenderness. Nothing?
No.
Okay, so there's no tenderness when I palpate the pinna and the tragus area. I'm going to go ahead and look inside her ears. Okay. So there's some hair throughout the ear, which is normal, but I don't see any cerumen. There's a pearly gray color to it. The cone of light on this ear was about 7 o'clock on the left ear, and the right ear was about 5 o'clock, which is normal. Now I'm going to go ahead and do my Weber test. So I'm going to hit the tuning fork. I'm going to place it on the top of your head, and I want you to tell me if you hear it on both sides of your ears.
Yes.
Yeah? Okay. Good. So she has good hearing in both ears. She's able to hear the tuning fork on both sides. So now I'm going to go ahead and do the Rhiney test. So I'm going to have the tuning fork above here, and you're going to tell me when it stops. And then I'm going to have it on the side of your ear, and you're going to tell me when it stops.
It stopped.
Okay.
It stopped. It stopped. It stopped.
Okay, good. So her Rhiney tests are normal. The bone conduction or the air conduction was about 2 times longer than the bone conduction, which is good. There's no appearance of conductive or sensory neural loss. So what I'm going to do next is do a hearing test. So I'm going to whisper in your ear from 3 different points, and I want you to tell me what you're hearing.
99. 21.
43.
43.
Okay, so I'm gonna go ahead and do it on the other side.
86. 38. 51.
Good. So she was able to hear and repeat the numbers on both sides of her ears. Yeah. So I'm going to assess her mouth and throat now by looking at her. Her mouth is symmetrical, her lips are symmetrical. I don't notice any drooping. Her lips are nice and pink. I'm going to look inside her mouth. Okay. Okay, so her mucosa is nice, moist, and pink. Her teeth are intact. She looks like she has good oral hygiene. I don't notice any odor. Her tonsils don't seem red or enlarged. Her uvula is midline. I'm going to test her gag reflex. Okay, say okay. Stick out your tongue. Push up on the roof of your mouth. Okay. So her cranial nerve toe is intact. She had gag reflex. Her uvula moved up and down. I'm going to have you taste this and tell me what you can taste. Okay, close your eyes.
Lime juice. Good.
This is lime juice. So her cranial nerves 7 and 9 are intact. Okay. So now I'm going to assess her neck area. I'm going to start by palpating her lymph nodes. So tell me if anything is tender to the touch. Anything?
No.
Okay. So I don't palpate any lymph nodes, no bumps. She doesn't have any tenderness. When I palpate, I can see her trachea is midline. I'm going to go ahead and palpate her carotid pulses. Okay, so carotid pulses are 2+ bilaterally. I'm going to have you just turn a little bit this side. I'm going to palpate her thyroid. Go ahead and swallow. Okay, so I don't feel any bumps or any enlargement of her thyroid. No goiter was noted. I didn't feel anything when she swallowed. So I'm going to assess your carotid and your thyroid arteries. Okay, lean forward. Okay. So I don't hear any bruise for either carotid or thyroid. Okay, so next I'm gonna inspect her posterior chest. For video purposes, I'm gonna have her keep her sweatshirt on, but her skin is clear, it's even throughout. No open wounds or lesions. By looking at her, I can tell her thorax is symmetrical. Her breathing is regular and non-labored. I don't notice any barrel chest or anything like that. So what I'm gonna do is palpate for the tactile fremitus. So when my hands touch your back, you're gonna say 99.
99. 99. 99. 99.
Good, so tactile fremitus is present and normal. I'm gonna percuss the chest. So upon percussion, there is resonance heard bilaterally, which is normal. What I'm gonna do now is assess her diaphragmatic excursion. So I'm gonna have you take a deep breath and hold it. Okay, so I'm gonna mark it with my thumb. Okay, so exhale, take a few deep breaths, a few regular breaths. Okay, now take one big inhale. Okay, so upon her inhalation, the marking from my index finger to my thumb is about 4 centimeters, which is normal. It should be about 3 to 5 centimeters. So I'm going to now assess her lung sounds. So I'm gonna start in the front first. Okay, take a big deep breath when my stethoscope touches you. Okay, turn around. Okay, so her lung sounds sound clear, no adventitious sounds on both sides. Okay, good. So next I'm gonna listen to her heart sounds. So I'm gonna start with the aortic, which is at the second right intercostal space. Now I'm going to pulmonic, which is the second left intercostal space. Erb's point, which is the third left intercostal space. Okay. Tricuspid, which is the fourth left intercostal space. And the mitral valve, which is the fifth left, kind of have to lift. Okay, good. So no abnormal heart sounds are noted. I'm gonna have you lay back. I'm gonna assess for jugular vein distension. So at a 45-degree angle, I'm gonna look at her neckline, and I don't notice any jugular vein distension. From here, I'm also gonna listen to her apical for about a minute. Okay, so her apical is 72. Okay, I'm going to palpate the different arteries. So we did the carotid artery already. You can sit up again. Okay, I'm gonna assess your radial arteries. Okay, so radial arteries are 2+ on both sides. I'm gonna assess the posterior. Bend your knee. Okay, 2+ on this side. Okay, 2+ on that side. I'm going to assess the posterior tibialis posterior artery. Okay, 2+ on that side. 2 plus on the right side. I'm going to just pull this down a little bit so I can assess your dorsal pedis. Okay, that's 2 plus on the left side. And 2 plus on the right side. Okay, just lie back for me one more time. I'm gonna go over her abdominal artery. Okay. And I'm going to palpate for the iliac artery. Just bend your and I'm going to palpate for your femoral arteries. Okay, so abdominal, iliac, and femoral arteries are present. I'm also gonna try to auscultate for the renal arteries. Okay, so all arteries are present. They sound about 2 plus, which is normal. And that is it.